The Agenda with Steve Paikin is brought to you by the Chartered Professional Accountants of Ontario. CPA Ontario is a regulator, an educator, a thought leader, and an advocate. We protect the public. We advance our profession. We guide our CPAs. We are CPA Ontario. And by viewers like you. Thank you.
For a while now, doctors in Ontario's intensive care units have been sounding the alarm that this third wave would be brutal. Tonight, we hear from two about their serious concerns as patients keep coming. Then our Ontario hubs explain why getting a new driver's license right now is challenging. And from a new stay-at-home order to record real estate prices, we've got the Agenda's Week in Review. I'm Nam Kiwanuka. It's Friday, April 9th, and that's next on the agenda. At no time during this pandemic have there been more people in the intensive care units of the province than right now in this third wave. Joining us to share their experience a year and counting into this crisis, both in Ontario's capital city, Dr. Michael Warner, Medical Director of Critical Care at Michael Garron Hospital and a member of the COVID-19 Provincial Critical Care Table. And Dr. Shelly Dev, Staff Intensive Care Physician in the Department of Critical Care Medicine at Sunnybrook Health Sciences Centre and an Assistant Professor in the Department of Medicine at the University of Toronto. Welcome to you both.
Thank you.
Thanks for having us.
Really excited to have you both on the show to talk about this. It's been a heavy week. So last week, you were among 153 ICU doctors across Ontario who sent a letter to Premier Doug Ford, Health Minister Christine Elliott, and Dr. David Williams, the province's Chief Medical Officer of Health. And here's what, in part, you wrote. If we continue to allow cases to grow exponentially, the ICU demand will outstrip supply of staff beds. Once overwhelmed, we could be forced to triage the critically ill, deciding who gets ICU care and a chance to survive and who receives palliative care and dies. As ICU doctors, we are the last line of defense, and we are ringing the alarm bell. Please hear it. We are imploring you to act now. Dr. Dev, let's start with you. Why was it important to add your name to that letter?
I think it actually echoes the distress and the worry of myself and all my colleagues in the world of critical care. And by colleagues, I mean doctors and nurses and respiratory therapists and the vast amounts of people who are involved in trying to respond to what's going on. And I think that beyond this being a political issue or political decision-making, this is fundamentally based on the guiding principle of healthcare in Canada, which is we must do our best to take care of the sickest people. And we must all agree that in this time, what's required is absolute the most drastic decision-making possible in the best interest of the most people. And nobody's better equipped to see that than people on the front lines.
Throughout this pandemic, Dr. Warner, we've been hearing this debate on who people should be listening to. Should they be listening to the politicians that they elected or to the public health officials who are on the front line of this thing? Why was it important for you to add your name to this letter?
Well, just to answer the first question or the first comment, I mean, the politicians are elected and they're the ones who have to make the ultimate decisions, and people who work in healthcare provide their input. The public health physicians at the same time are not on the same front lines that Dr. Dev and I are on. We're not public health experts, but we see who we're intubating, and we also have a very good idea of how finite the resources are that we're able to provide. And what we saw and what we were concerned about is being in a position where we cannot offer care to a patient that we can take care of today, where that patient will have to die, but today we could save them. And there's no more morally distressing situation than that for any healthcare worker. And it's a situation we haven't faced in this country, as far as I know. It's one that I still hope we can avoid, which is why writing that letter, at least that segment of that letter, was really important. And I think it helped lead to some action that was taken by the government recently.
And just to follow up on that, do you think that there is a disconnect between what doctors think should be happening and what the provincial government thinks should be happening?
Well, our line of sight is different. Dr. Dev and I, we work in the ICU. We see the sickest of the sick. We're both making a living. We don't have to think about businesses. At the same time, the message from doctors in general is to protect people, because we don't want people to get sick and die. And life is a finite journey. And my view is that if the healthcare of people is protected, the economy will recover thereafter. But when you try and do both at the same time, when you're dealing with a virus that you have no control over, people will get sick and businesses will suffer. So I think that it's really important that we focus on healthcare, especially now in the third wave.
And Dr. Dev?
I agree with that, but I also feel that even though we're not part of those other industries that are suffering, we are seeing people who are having to be on the front lines and make a living and having to provide services that we all agree we all need, who are getting sick, whose families are getting sick. And if we don't take a longer view approach to recovery and we just respond to in the moment, concerns that are raised or by different members of the public, we will not see the end of this. And what we're arguing for is, really difficult things that people have to go through, really difficult moments of isolation that Dr. Warner and I, as human beings, are navigating as well. And I got to say, I hate it. I hate the experience of lockdown. I hate what my children are going through. I hate what my parents are going through and my in-laws. I hate it. But what I hate more is watching what is happening to people who are getting sick. It is so devastating, and I hate that more. And I think you can feel both things at the same time. That's what we're asking of people, because that latter part is so much worse.
And Dr. Warner, just to build on what Dr. Dev just said, I take public transit, and this morning when I was coming to work, I still saw people not practicing physical distancing or wearing masks. You're both, you see this every day. You're at the intersection of life and death every day. And I'm sure you've had to sign death certificates. What would you want the people who are watching this show or listening to us right now, what do you want them to know about this virus?
Well, unfortunately, I've signed 29 death certificates for COVID-19 since the beginning of wave one. And it's unfortunate that I had to keep track of that, but I thought it was important just so I could kind of measure the impact of this based on my own practice. So I think that, there's individual responsibility, but there are so many people in this province who cannot minimize their exposure risk because of the work that they do. And these are the people that we truly rely on, the ones that we claim are essential, who have not been adequately protected. And even with the change in policy to provide vaccinations in a targeted way to people over the age of 18 in certain postal codes and in certain industries, it's still not enough to prevent the 30 to 50-year-old factory worker, rideshare driver, checkout clerk from ending up in my ICU with a breathing tube. Once the variant enters the household of these individuals who often live in congregate settings with multi-generational homes, it runs the table in the whole house, and somebody or many people get sick in that household. We need to protect those people. That has to be our focus, in addition to the lockdown measures.
And working in the ICU, I'm sure you've had to make hard decisions so far. Health Minister Christine Elliott recently said the government is trying to boost hospital capacity, but it has yet to prepare a cabinet order indemnifying ICU physicians from liability in making difficult triage decisions as to which patients will get the resources that we currently have. From your vantage point, Dr. Warner, how critical is it to get this cabinet order passed?
Well, there is an emergency standard of care that's been penned by the Critical Care Command Table and circulated to all the hospitals. Unfortunately, this was not debated in the public realm, and I think it should have been. And what it will allow us to do, if we're in a triage situation, is, depending on the level of triage, withhold life support. That means not put a new patient on a breathing machine after measuring their standard short-term mortality risk, basically the chance of them being alive 12 months from now. What it doesn't allow us to do, which would be outside the Healthcare Consent Act, is to take a patient currently on life support off that machine. But I think this presents a queuing issue and would really worsen my moral distress, because there are patients in every ICU in this province, I would say, for whom it's very unlikely they will survive their ICU stay. Yet the new patient, who could be 30, 40, 50 years old with COVID or some other disease, may not be able to receive care if we're in this triage situation, because new patients we may have to withhold care on, as opposed to withdrawing on incumbents.
And as a physician, Dr. Dev, I know when you went into this business was to help people. Finding yourself in that situation, that's a difficult decision to make, is it not?
Of course it is. It's heartbreaking. It's contrary to what you signed up for. What is one of the best things about our healthcare system in Canada, and that we're also proud of, is that we all agree that every person deserves to be taken care of. The sickest people deserve our attention first. It doesn't matter where you come from. It doesn't matter where you live, what your postal code is, your area code. If you come in and you're sick, and you're the first one who comes in, you're the first one that we see. And when you have to factor in these decisions about who is more, according to a protocol, who is more, not to use the word worthy, but who is more appropriate to be put on life support, none of us really signed up for that kind of decision making, and it challenges the fundamental way of thinking when you get into medicine in Canada.
And Dr. Dev, earlier this week, Sick Kids announced that they were preparing an ICU unit to treat adults because of ICUs filling up in the GTA, which is very, it's mind-boggling that this is happening. And yesterday, Ontario physicians were urged to ration one of only 2 drugs known to reduce mortality in critically ill COVID patients due to a shortage. We're also hearing that the province has ordered hospitals to halt non-emergency surgeries as patients with COVID-19 fill ICUs. Dr. Dev, how concerned are you about the current situation that we find ourselves in?
I mean, I don't think we need to say anything new that we haven't already said. This is awful. This is brutal. What is heartening to me is that, my colleague physicians across the board are trying their best to help each other to make room for these patients. When you talk about sick kids, when you talk about patients that we've moved out of Toronto to areas like Peterborough and Kingston, where our colleagues are helping us do this, on one end, it just highlights the unbelievable sense of community amongst medical practitioners, which is what we deeply need. And on the other hand, it actually should demonstrate a reasonable amount of worry and fear. I have never been this terrified in the whole course of this. I'm sure Dr. Warner will agree that what we're seeing now is unlike what we saw earlier on. These are people, when you look at them, what you see is yourself. You see any person who you're next door neighbors with, that you're friends with, that are vulnerable. This is all of us. And where early on, we probably rested on our laurels a bit with these, with rationalizing around, well, it's older people or it's people with pre-existing conditions or what have you, to give give yourself a feeling of security. This is not that. This is anyone and anything I wish to tell anybody about what they could rely on as patterns to identify who is more likely to get sick. I so wish I could say something like that, and I can't. And that's what scares me.
Dr. Dev mentioned fear and being afraid. Dr. Warner, how are you feeling?
Well, it's been a long 14 months for everybody in healthcare. And I remember before wave 1 hit us, seeing what was happening in New York and Italy, and crying on the way during my drive to the hospital because I was so scared about what was going to happen. We didn't have vaccines. We didn't know how bad it would be. And wave 1 wasn't as bad as at least I expected. And wave 2 was bad, but we were prepared for it. Wave 3, the variants, this is a different disease. This is a different pandemic. And I am more fearful now than I ever have been in my life or in my career for what's coming. And I'm so worried about having to ration care and not being able to provide care for patients that we normally can. And I also am deeply concerned about the parallel epidemic of non-COVID related care being delayed and deferred. And it's very fortunate that we do have vaccines coming. And I think that provides me with a modicum of reassurance. But it's difficult to put into words how challenging the next 2 months, I hope it's only 2 months, will be for everyone in Ontario because of what they have to go through at home, and also for the people who are sick in the hospital and their families who are watching on Zoom.
Physician burnout is nothing new. Are you worried that this is going to have a huge impact on the people that we do need to carry us through this? I would like to ask you both. Dr. Warner, I'll start with you.
I rarely talk about myself in the media, but I'm completely burnt out. And I think just what everyone I work with is, it doesn't mean I won't be there. It doesn't mean I won't be working hard, especially the nurses, respiratory therapists, personal support workers, housekeepers, all the people who keep the critical care machine going. But this has had a huge impact on all of us because we live COVID at work, and then we live COVID when we leave work. It's 24/7 experience, and we see so much sadness and so much death. And because it's preventable, it hurts so much more. And I've shared some stories of patients in the media that I will never forget. And this has been a life-changing experience.
And Dr. Dev?
So physician burnout or healthcare worker burnout and mental health is one of my areas of expertise, and I've spoken extensively about it prior to the pandemic, where we weren't doing great prior to the pandemic. We had an epidemic of healthcare worker burnout. And what we need to understand in our healthcare system is that our healthcare system functions like a circuit, and any breakdown in that circuit will affect everybody behind it. And what is critical in our circuit is the health of the healthcare workers, because that is what is going to determine largely the quality of care any of us receive. So what you have is workers who are, just like Dr. Warner describes, he says he's not used to talking about himself. What that reveals is the thought process of the average healthcare worker. The headline you'll never see in the newspaper, that the average healthcare worker is just a good, decent person who really just wants to help people. And what they are most afraid of is being too tired or too exhausted or demoralized to the extent that they may make a mistake. They are not worried enough about their personal health. They're worried about how their personal health will manifest as a problem for their patients, for the public. And what we need to do, all of us as patients, is identify that connection between the health of the worker, our most valuable resource. We can have billions of ventilators, and if we don't have enough workers to take care of them and administer their uses, or same with medication, we will have nothing. And if we don't make the connection between how we all do as patients to healthcare workers, we are going to struggle and suffer. And I am so worried about my colleagues and my friends who I see every day just doing their best with diminishing personal returns in terms of their health. So it's something that we've been so lagging in terms of identifying how critical that is the health of the worker in connection to the health of the patient.
Just listening to you both speak, for me, first of all, I do appreciate, I know you say that you don't talk about yourselves, but I think it's really important for people to hear what you have to say, because there seems to be this kind of disconnect. I don't know if it's because you can't see COVID-19. I don't know if it's social media, but there's still a fair bit of skepticism towards reports that ICUs are hitting their capacity. Excuse me. For instance, I want to show you a tweet from columnist and former editor-in-chief of Sun News, Mark Toohey, and he tweeted this a couple of days ago. He writes, "One of these things," and this is in caps, "is not like the others. Hashtag COVID-19 death rate has never exceeded 0.6 per 100,000 residents in hashtag Ontario. It's been hovering around 0.1 per 100K since the beginning of March. No one," and that's in caps, "is in charge. ICUs are not full. The experts," in quotation marks, "are lying. Why are we in hashtag lockdown?" How would you respond to those who might feel like this is being overplayed? Dr. Dev, I'll start with you.
I do absolutely relate to that feeling of disconnect, because in our hospital at Sunnybrook, it's a very big hospital. There's a lot of intensive care units. And there are moments where, when I'm not looking after critically ill COVID patients, there is a part of my mind that can go off to, yeah, it's bad. It's bad. I get it that it's bad. And it's more of an intellectual check-in. It's less emotional. And when I go back into the COVID unit, it comes right at you as, this is terrifying. This is horrible. This is tragic. I absolutely understand this disconnect, because you ask yourself, can it really be this bad? And all I can say is that for those of us, on behalf of those of us who are there, or people who have lost people to this illness, is that yes, it's absolutely a real thing. What, I'll be frank with you, angers me so much about irresponsible reporting or tweeting by people who have a platform is to ask themselves, what on earth could the ulterior motive be to scare the public and to, raise the alarm on something that we're worried is the scourge of our modern times? What on earth could be the motivation to do this? It boggles my mind. It's absolutely repugnant to be that irresponsible. And I ask other people to ask themselves, when people have those lofty perches and say these things, what do they personally have to lose in comparison to the frontline grocery store worker or the factory worker or the person doing deliveries? Those are the vulnerable people. Those are the people we all need to be invested in protecting. Our teachers. When you say things like that from your perch of privilege, the word for me is repugnant.
And Dr. Warner?
Dr. Dev said it very well, but I told the public now that I'm burnt out, and a big part of that is just the grinding that people give people like me in the media about the situation they're in. I mean, why would we lie? I mean, it's really bad. It's really terrible and imminently foreseeable. Like, we warned about it and nobody did anything, which is so frustrating. But for Mr. Toohey and lots of people, they don't have a mental model of what COVID-19 looks like. They know what dying from cancer looks like, or a heart attack, or a stroke, but nobody sees what we see. And maybe that's our responsibility and our fault that we haven't shared it. So that's one of the things I tried to change. And I pivoted. And I asked 2 families to allow me to share the stories of their loved one in public. And I think that helped turn the tide of public opinion about the mid-40-year-old woman who ended up dying on a heart-lung machine, an ECMO machine, after acquiring COVID-19 from her husband, who was a factory worker at a factory that was an outbreak. But he wasn't allowed to miss work because the outbreak wasn't on his shift. Or the young man in his early 30s, a non-essential worker who was forced to have FaceTime at the office because his boss wanted him there. And he shared an office with another young man who didn't wear his mask or adhere to public health measures, and he got the variant from him. And he spent a month in the ICU. Those are real stories, and that's what I see. So anyone tells you this isn't real doesn't walk in my shoes.
Sorry. Very unprofessional of me, but it's really hard listening to your stories because those are all families that are impacted. And I know, Dr. Warner, I don't even know where you find the time to do all of this because you are juggling so many things, but I think you being on Twitter has helped people to, has helped to empower people. We've been talking a lot throughout this pandemic about COVID fatigue, about how people are tired of it and, another lockdown. This past week we had, the stay-at-home order was announced. In your, from where you both are, what are your thoughts on the recent stay-at-home order? Do you think it should have come sooner? Dr. Dev, I'll start with you.
Yes, I do think it should have come sooner. I'm grateful that it's here. And I want to just reiterate the point of, when people like Dr. Warner and I talk about these things and really advocate for these stay-at-home orders, we are also parents and partners and children of other people and dear friends of other people. And our lives are in total disarray and difficult at home. I know Dr. Warner and I both have our kids on the other side of our doors right now, homeschool. We are both trying to do this with the help of our partners. We are both worried about parents in our lives. I will say personally, loved family member who's going to have delay in essential surgical treatment because of this. And it's like I said, I hate the experience of this. I have found it so personally difficult. I have struggled with my own anxiety in the middle of it, as have my children. And still, I cannot bear to watch these people coming in and their families decimated by what is happening when we don't make the difficult decision to lock down, to distance, to mask. The fact that it is difficult and so hard for all of us doesn't mean that it isn't also the right thing to do.
And Dr. Warner?
I speak very directly. It definitely came too late. And it wouldn't have been enough if we just had to stay at home. I was reassured by the pivot in the vaccination strategy to target the essential workers and high-risk postal codes. But again, that won't be enough. I mean, the Premier has made paid sick leave a political issue, which it isn't. It's true that once you get COVID, you can get 2 weeks off. But what about my factory worker, the husband of my patient, who didn't want to go to work, but he lives paycheck to paycheck? And if his boss says, you got to come to work, he's going to go to work. He's not going to take a day off to get tested. Even if vaccines were available to him, he wouldn't get paid to take that day off to get vaccinated. And that's just not right. And we have to acknowledge that that is not humane. And until that changes, until we have workplace inspections, rapid tests in congruent work settings, truly redefine what is essential during this once-in-a-lifetime experience, those same people will not receive the adequate protection, and they'll still be coming to our ICUs.
And when we talk about humanity, I'm sure you entered this profession, like I mentioned before, to help people. After this past year and the things that you have seen on the front lines, would you recommend someone who is thinking about going into this profession to go into this profession? Dr. Dev?
I often say to my trainees that medicine is really, really difficult. That you don't get told that, how personally painful the experience can be as a human being. And a lot of times you go into medicine not having experienced a lot of essential moments in your life, like birth and death and chronic illness. It's hard. It's super hard. But it is also quite amazing. And to be able to say that your job is about helping people, being present with people as they endure really difficult moments, to have that seat next to them is the biggest privilege of my life. To help train people to do this is the biggest privilege of my life. To support my colleagues in that work, biggest privilege of my life. It is a difficult journey, but it is also quite amazing. And like I've said before, it can be both those things. And I hope that people who feel that connection to this kind of work absolutely pursue it, because that's what we need. We need those people who have that goodness in them to do this.
And Dr. Warner?
There's nothing else I would ever do other than being an ICU physician. I think it is a tremendous responsibility. The trust that you build with your patients, they tell you everything. They've never met you before. They allow you to have life and death decisions with them and their families. They trust that you're doing your best for them at all times, and we do. That's a huge responsibility, and I'm honored to have it. And also during this pandemic, I feel very lucky to be able to actually have a role where I can change the trajectory of an individual patient, or perhaps the governmental response to this entire thing through some media influence. I think a lot of people just have to sit at home and deal with the situation and feel like they don't have any power. And that must be even harder. So I feel very, very fortunate to be in the position that I'm in. And I would encourage anyone who thinks medicine is for them to continue on that journey.
Dr. Warner, Dr. Dev, it's been such a privilege to speak to both of you. We know you're very busy, and we appreciate you making the time for us. And thank you so much for your insight. It's been an absolute pleasure. Take good care.
You too, be well.
Whether it's because you just turned 16 or because the pandemic made you need to learn to drive, getting licensed to hit the open road right now is all stop signs. Our Eastern Ontario Hub journalist Marsha McLeod has been looking into that and joins us now from Kingston to explain. Welcome.
Thanks for having me.
All right, Marsha, catch us up to speed. Why can't people get their driver's tests?
Well, let's go back to the beginning of the pandemic. I know it probably feels a long time ago now, but so right away, pretty much by the end of March, drive test centers across Ontario, which is where you can do driver's licensing tests, had shut down. And it wasn't actually until June that they started opening back up again for G1 tests, which are written tests. And then it wasn't until August that we saw G2 tests were getting back online. Those are road tests, and pretty important because that's the test you need to be able to drive in a car alone. And then in September, we saw full G tests come back. But it was pretty short-lived because by November, centers were starting to shut down to road tests again if they were in gray zones. December, we had the province-wide lockdown. And now, just last week, with the shutdown announcement, road tests are canceled in Ontario, for at least for the next 4 weeks. And the bottom line is more than 500,000 tests have been canceled, specifically road tests in Ontario, since the pandemic began.
I actually want to pull up a passage from your article for TVO.org. It reads, drivers describe waiting up to 5 months for a road test, having 3 or more tests canceled in the past year, and constantly checking for tests online, only to see 0 slots at their local test center. On March 29th, TVO.org checked for G road tests at 11 test centers in Eastern Ontario using the provincial booking website. 9 did not show a single available test in the next 12 months. Of the 2 centers with available tests, the earliest dates were July 6th and September 17th. Marcia, frustrating to say the least. Obviously, we're talking to not only young drivers, the 16, 17-year-olds who are getting their G1s and G licenses, but you're also talking to a number of other people, including newcomers. What did they have to say about the frustration?
So I spoke with 8 drivers, and I think frustration is a good word, but another good word could honestly be desperation. I think they're feeling abandoned by their government and have a sense of, does the government truly understand how important it can be to have a driver's license in specifically in this country where not every place that people live has good public transportation, and especially during a pandemic, people aren't necessarily feeling comfortable taking public transportation. And specifically with respect to newcomers, I spoke with 3 newcomers, each of whom have been unable to get a road test since arriving in this country. One man, Redouan, he told me that since he arrived in Canada in August of 2020, and one of the first things he did was get his G1. But he has not been able to get his full G license to be able to drive on the road, and he said it's been incredibly difficult. He takes 3 buses to get to work. It's really challenging in snowy conditions, and he can't even be able to look for tests or look for jobs outside of his own community.
Now, you also spoke to one woman who had some challenges navigating a very interesting and unique one, but nonetheless a frustrating experience. What did she have to tell you?
So I spoke with Maureen Walter. She's 58 years old. She lives in Scarborough, and she lives with fibromyalgia and osteoarthritis. And she told me she started trying to get licensed to drive when walking was becoming more challenging for her. And she's had 4 road tests canceled in the last year. And I think she's beyond frustration. I mean, she told me that she stayed up until the last time her test was canceled. She was up until 2 a.m. on the Drive Test website looking for cancellations. And one of the things that's been really challenging for her is she's on a fixed income on disability support. And she said to me, it took years to save up the $600 to be able to take driving lessons. And yet those lessons have just been chopped up over the last year. Her last one was in October of 2020. And she doesn't think she's going to be able to get a road test until September of 2021.
Now, I'm getting a sense of, driving sort of equals freedom in many ways for people. What have people told you about this in terms of, being able to move freely?
Mm-hmm. I think for some people it's freedom. Like, I think people might have memories of being 16, 17 and getting to use your parents' car for the first time. Mm-hmm. But I think for some, it's freedom and it's independence. But I spoke with 2 new moms, one of whom her child is only days old right now. The other, her child is 8 weeks old. And they both said to me, it's really about safety. It's about being able to get your child and you where you need to go in the safest way possible. And as well, even just for the newcomers who I spoke to, they were saying, in this country, without a license, you can be incredibly isolated. It's very difficult to run errands, difficult to get where you need to go, even to get in the outdoors. And I think that what people have said to me is that it's not just an inconvenience; it's profoundly distressing, and it's a basic necessity in many Ontario communities to be able to drive.
Do we have an idea of what the government is doing to address this problem?
Yeah, so what the Ministry of Transportation has said to me is that once road tests resume, they're going to hire additional examiners to help clear the backlog. And actually, the drive test centers are run by a private company called Serco Canada, and who are contracted to the Ministry of Transportation. And they actually have a standard which they're supposed to be meeting, which is that they need to be able to offer drivers a road test within 42 days. So you go on the website and you should be able to find a test within 42 days near you or at your local test center. The ministry said to me they've suspended that standard during the pandemic, but I spoke with one driver who she had a test scheduled in 158 days and then it was canceled.
Oh, wow. I imagine the opposition critics are saying this is not enough.
Yeah, I spoke with Jennifer French, who is the NDP critic for transportation, just before we spoke before the shutdown announcement. But she said to me is that her office has heard consistently from both her constituents and others during the pandemic that they've been unable to find a road test. And she said the government needs to clear the backlog, but they also need to do it safely, not just throwing examiners into situations which are unsafe.
I know, obviously, a frustrating experience, but any advice for young drivers or drivers in Ontario who are looking to get their tests booked?
What I have really heard and what I've heard from people who have been, quote unquote, successful in getting a test is that you just have to keep on it. I've heard people say they check the website every day, multiple times a day. They're checking for cancellations. If a spot pops up, you just have to grab it immediately. So I think just the name of the game is just checking.
Marcia, I want to thank you so much for bringing another important story from this province. That's Marcia McLeod, our Eastern Ontario Hub journalist.
Thanks for having me.
The agenda this week tested the waters on whether kids will be going to summer camp this year, explored the future of online learning in the province, and checked in on the rising real estate market. The Agenda's Week in Review begins with a sometimes confusing messaging from Queen's Park on their pandemic protocols.
We have this constant up and down push and pull from the government. And I think that's what makes this lockdown different, is that people are just incredibly tired of being jerked around, and they want a decision made, and for this to be resolved. We're heading into more than a year of it. So I think the government is going to face its most difficult audience yet with this latest lockdown.
Amanda, you just heard Laura call it a yo-yo effect. What kind of impact does that have on the general public when a yo-yo effect, for lack of a better expression, takes place?
I think you see people tune out, right? They see inconsistencies from the government, and then they decide they can't trust what the government is going to say. So instead, they turn inward and say, okay, I'm going to make decisions for myself and what I think is best, which may or may not be in keeping with public policy, in keeping with what the doctors are advocating or the elected officials. I mean, that is a real danger here, right? Is the minute, and I think that the communications challenges we've had over the last week with, the Premier and the Chief Medical Officer of Health for the province saying schools are safe versus regional medical officers of health closing schools, all that tells people is they can't trust anyone anymore, so they ignore it. And I think the minute the public turns off and they do whatever they want, you see these rise of individual businesses staying open. These aren't rebels without a cause. These are yoga instructors. These are gyms. We have the public tuning out of the government's message and what they want them to do. And without that social contract, these lockdowns are not effective.
Gabriel, what's your view on that?
Yeah, I mean, I agree that there's definitely a yo-yo effect that's happening. I think we need to follow the evidence here. Healthcare providers have been coming forward in addition to medical officers of health. And we've been doing this for months, well before even wave 2, talking about workplaces as a serious risk for transmission. And we've been talking about strategies like, for example, paid sick leave. We've been talking about bringing vaccinations out to communities that are hardest hit by this virus. And I agree. I really feel for small businesses. We know that 68% of these outbreaks that are happening in workplaces are happening not at ma and pa shops. They're happening at large-scale manufacturing plants, food processing plants, and factories. And so if we're really going to do something different that isn't just the yo-yo effect that we're talking about, we need to address occupational spread. And we need to bring this pandemic down to a point where we can open up businesses where they're not having to buy inventory, sell inventory, where they're not having to suddenly shut down or suddenly open. I really feel for them.
I will get to that angle in a few minutes' time, but Laura, I want to come back on another specific example of something that, again, just a few days ago, by means of example, we heard the Education Minister, Stephen Lecce, and the Premier of Ontario, Doug Ford, both say things like, the best and most appropriate place for students nowadays is in school. There are mental health issues when they're not going to school, etc. We heard all the arguments. And then a whole bunch of medical officers of health came out and said, you know what? There are too many outbreaks in too many schools, and we got to pull the pin here. And suddenly, as of today, school is shut down again. Can you help us understand what powers not advisory powers, but actual powers local medical officers of health have in terms of schools open, schools closed, businesses open, businesses closed?
Well, I'll try, Steve, after a year of covering this. The medical officers have what's called a Section 22 power under the Health and Promotion Act. I might be messing that title up, but essentially they have legal powers to order closures from everything we saw, such as the Amazon facility in Brampton, which was ordered closed a little while ago for a couple of weeks, and of course to schools. And I think you saw at the beginning of the pandemic, there was certainly a lot of resistance from the local medical officers to use this power. And you sort of saw a bit of a battle brewing between them and the province of who was a game of chicken, if you will, of who was going to act first. I think now you're seeing them using these powers more widely when they're dissatisfied with what the government is doing. And so that opens up a debate over who should make the decisions.
Let's look forward and talk about this summer. Now, I know all three of you, for example, are working towards the expectation that you will be allowed to open this summer, but that decision has not yet been made by the provincial government. So, Cassandra, tell me, what are you and what are the folks at Cedar Ridge doing right now to prepare to open during a summer of COVID-19?
Yeah, so our plan is to open as long as the government allows it. We have been implementing sanitization stations. We are changing our program. So instead of having 5 program areas a day, we're switching it to 4 to allow more time for sanitization and distancing, because obviously some programs are going to have to run a bit different. We are also planning for all activities to be outside. You know, we like to say that there's no such thing as bad weather, just poor clothing choices. So we are planning everything's outside. Thankfully, we have 150 acres and usually about 125 campers. So that's more than an acre per camper. So hopefully we'll be able to allow for lots of distancing, and we're planning to do cohorts and yeah, just planning to do the best we can.
So it sounds like you are definitely prepared, but I have to ask this follow-up. You know, one of the joys of summer camp is to get as absolutely filthy, dirty, unsanitary as is possible under the circumstances. Is that off this summer if you guys end up opening up?
Yeah, I mean, it's going to be different. It's going to be a summer like no other, but we're doing our best to implement as many sanitization stations, one for each activity station. And we've also implemented hand washing, outdoor sinks, just to do the best we can.
Okay.
Yeah.
Melissa, how about a Trails Youth Initiative? What have you got planned for this summer in the event that you're allowed to open that would prepare you better for COVID-19?
Well, I'm feeling optimistic and confident. We're in a state of readiness. There's a lot of support from our kids and parents, importantly, our staff and the community to open. We have already begun hiring for our summer staff, and we've booked our permits for the backcountry canoe trips. We've had ample time to develop risk management plans, policies, and procedures. All camps are built on trust. So if we say yes to our families to open our doors, that lands with a lot of weight. And it's a massive responsibility to care for 150 youth and 40 staff. So our community knows if we say yes to camps, that we're going to do everything in our power to stay safe. We're considering this to be the most important summer ever in our 30-year history. The big trick will be to drive down that risk of COVID entering the isolated environment through testing and screening. And we're seeing evidence from success in other parts of the world that we can effectively manage these risks.
Let me ask Jack Goodman about that. Are you confident that if you're allowed to be open, you can open safely to the satisfaction of all parents and campers?
We're absolutely confident. We know that the camps that operated in the United States last summer, for example, day camps and overnight camps, had the very same equally low COVID risk. So as was already stated, the plan that we've submitted, and we're awaiting a refinement on that plan with whatever isolation the kids can take before camp begins, even if they're in school, limiting that social engagement. a testing program, and we're working very hard with the government to establish a testing program for all of camps so that it will be equitable and equal across all the landscape. So whether there are camps that can afford to absorb or pass on those costs, or camps that service individuals where those degrees of freedoms don't exist, that'll be an enormous part of the program of safety. But more than ever, as was described, cohorting, modification to programs, the distancing, wearing masks indoors, shifting whatever activities were indoors, outdoors, and baked into the camp experience is so much time outside. And plus, we need to do whatever we can to put all of these measures in place, knowing the evidence is strongly supportive of them. We've got to get those kids their mental health restored, and we think the camps are going to be a huge part of that.
I describe this, Steve, as a very significant shift to the public education system in Ontario. Throughout the years, we have documented changes to the system, whether it's, the introduction of full-day kindergarten, whether it's, the elimination of grade 13. Here we have another shift happening in public education where, according to this document that was shared with education stakeholders, which is teacher unions, school board reps, principals, admin, trustee associations. What the government is proposing is legislation that would entrench remote learning, online learning, whatever you want to call it these days, would entrench it in the public education system, that would give parents, give families the option at the secondary level or the elementary level to either choose to send their children to a bricks and mortar classroom or to continue online learning.
All right, Annie, this is being characterized or portrayed by the province of Ontario as more parental choice. Is that the appropriate framing of this issue in your view?
Well, it is. I mean, it is a major shift. And I think a major part of this, and I want to, my proviso here is I love TVO. I think it's incredibly important. I loved it for my kids. I love the agenda. It's great. But part of this major shift is to centralize control over online learning with the Independent Learning Center. And that's taking control over that part of the learning for secondary students out of the hands of school boards, out of the hand even of the Ministry of Education, and handing it over to what is, a nonprofit. It is an arm's length agency of the government, but it's not accountable in the same way that governments are. So that's one worrying piece in this. I think the other piece goes back to what Michael was saying and the difference between the learning we're having right now, which is still kind of emergency learning. So it's not like we've developed all of the courses that are necessary in the system to deliver them online. Teachers and boards are adapting what's available now and delivering them online. This shift the government is suggesting would make all of that happen so that courses would be available to deliver online and happen very, very quickly, so that suddenly you would have all of the online learning, again, under the control of TVO to TFO, the Independent Learning Center, and all of the courses ready to go out in about a year. And I think that for everybody right now, and back to how we don't have enough information about how kids are doing as it is, to do something huge like this in the middle of the crisis that we are still definitely in Ontario, where there's massive change, where everything is destabilized, is incredibly worrying. And it's really hard to understand what's the rush. Why do this? Why now? On the other hand, boards definitely, and parents and kids and everybody working in the system would like more information about what's going to be available in the fall. It still seems as if we're going to be in a period of instability. So in ensuring that we've perfected and we understand how online learning works is probably the most important thing we can be doing right now, rather than just going, let's change it all so that anybody can have this choice.
Well, Annie, they do say you never should let a good crisis go to waste, so maybe that's why they want to do it now as opposed to wait until the pandemic's over?
That could be true, but others might say that sometimes you can use a crisis to kind of disguise what you're doing, so that that in a crisis nobody's totally paying attention, and you make an enormous change. Caroline's right, to the whole public education system, but everybody's really just worrying about, are they going to get vaccinated, or is their school going to be open or closed? Everybody's eye right now is on the immediate crisis, and I would argue that we are not ready to make this change because, back to what I said, we actually don't know how it's been working. So it's like we're making this change before we figured it out. And that is, I think, not good for kids.
Michael, I need to get your sense of the significance of the move of online education from what we're experiencing now, which is essentially an emergency response to the pandemic, to a more fundamental, entrenched part of the province of Ontario's education system. How do you regard that?
Well, as Carolyn mentioned, I mean, it is a significant change, but it's a significant change that, depending upon how it's used, may not necessarily be a bad thing. You know, if you think about that 10-year-old grade 5 student who might be in a rural area, and the only brick and mortar school that they have an option to attend, they're being bullied at every single day. And, you know, it's just a crime to be sending them back to that building day after day. Providing that student with the option to do all of their classes online, to remove them from that situation, is not necessarily a bad thing. Now, if the government is doing this because they are hoping that this is a cheaper option of doing it, then that's a completely different story. And they're looking at moving mass numbers of students onto the online system.
Let me read this tweet out here, and Tim Hudak, I'll get you to respond first to this tweet. This is from someone named Ben Rabidou, who runs a market research firm, North Cove Advisors, who cover housing issues. And he says, spoke to a realtor friend who told me about a recent sale where their client, the seller, received 2 bids on the house, one at ask price and one $175,000, or almost 10% above ask. There were only 2 offers. Blind bidding process needs to seriously be re-examined. So says Ben. What says Tim?
Well, number one, governments of all stripes, whether progressive, conservative, liberal, or New Democrat, have had the view that a homeowner should decide how they sell their home. That is, after all, their personal property. They'll be making decisions on what kind of home they want to buy, their retirement, and it's human nature to try to get the best return you can because you're planning for your future. I think the real issue here, Steve, is not the system of bidding. It's a lack of inventory and supply in the marketplace. And I'll talk about Australia's DeBell did in a moment. So it's really, sadly, like, I totally get the buyer frustration right now. It's a cruel game of musical chairs. You have more and more people looking for homes, so fewer chairs available to find that home. And as a result, people get frustrated, prices go up. But it's not how you arrange the chairs. In Australia and New Zealand, where auctions are common, they're not mandated, they're common, they're experiencing the exact same thing. They're having record high prices, they have a lack of inventory, and an increased side of demand. So it's not how you arrange the chairs, it's getting at more inventory and supply in the marketplace to make sure home ownership stays within reach.
Since you mentioned Australia, we just happen to have a clip of how it works down there, down under. And Lisa, I'll get you to watch this and then comment first on this process, okay? Sheldon, if you would.
Let's get the show on the road. Who's going to give me a start now? How about we kick it off at $850,000? It's certainly worth more than that. Who would start me at that? Just put up your hand if you'd like to start at $850. You shouldn't be hesitating at that price. I'm at $850. I need to see a rise from there. 70, welcome to the bidding, sir. With my starter now at $870. 90, can I make it? Oh, 90, is it? Sorry, at $920,000. Great, strong bidding. Welcome to the bidding, sir.
Lisa, should we do that here?
You know what, my sentiments are very much aligned with Tim Hudak. And I must say, like, the sellers, obviously, when we think about houses today, we have to remember that the sellers should have the right of how they want their home marketed. We also need to keep in mind that, you know, even though that works in Australia, that's not going to work everywhere. And we have to keep in mind that even with blind bidding and the real estate transactions, that the new Real Estate and Service Act in Ontario already addresses this by giving the seller the option to disclose competing price offers. The industry is asking the province also to require the buyer's consent. And that's something that we have to keep in mind. But if we're going to move to a system similar, that consent must be heightened, and it must be consent from both the buyer and the seller. So all parties that disclose confidential offers, offer prices that could compromise, because it could compromise their negotiation positions. But as Tim said, what this is definitely a supply issue. And I can say, on TREB's position, one of the things that they focused on in their market year in review and outlook report, they've highlighted the missing middle research. And I'd encourage more people to even take a look at that report that was put out on treb.ca.
Okay, I'm going to get to supply in a little bit, but I'm intrigued by this Australian example. And Tim, let me bring you back in on this. I can appreciate how perhaps in Sudbury on a Sunday afternoon when it's minus 25 outside, that may not be the easiest thing to replicate. But having said that, are they onto something there that we ought to look into here?
Well, it is an option. And Lise Patel, the president of the Toronto Real Estate Board, Toronto Regional Real Estate Board, talked about the process, right? We actually did, beginning with the Wynne government, we talked about ways to give more choices in the marketplace for how you buy or sell a home. And that was followed up by the Ford government, that now more clear options in how you do so.
That's just some of what we covered this week on The Agenda. For more, including the full conversations, you can visit our website, tvo.org, our YouTube channel at youtube.com/theagenda, or our Twitter feed, twitter.com/theagenda. And that's it for this Friday, April 9th, 2021. Next week, we'll consider Ontario's vaccine rollout, discuss calls for paid sick days, and bring you another installment of our joint TVO Toronto Star initiative, The Democracy Agenda. I'm Nam Kiwanuka. Thank you for watching TVO and for joining us online at tvo.org. Have a great weekend, and Steve will see you on Monday.
Ontario Hubs are made possible by the Barry and Laurie Green Family Charitable Trust and Goldie Feldman. And by viewers like you. Thank you.